I sure wish I had known today's guest when I was in my late 40s, getting ready to transition through menopause. At the time that I was making this transition, there were really no open conversations about perimenopause or menopause. I don't even think I knew perimenopause existed at the time. I'm now 62, getting ready to turn 63. So this knowledge would have been invaluable to me. And that's why I do the podcast. That's why I like to bring guests to you, the experts who can help you navigate the rocky road of perimenopause smoothly into menopause. Today I have with me Dr. Liz Lyster. She is a board certified OB/GYN medical doctor. She has over 30 years experience. She's also a best-selling author and speaker. She's an expert in perimenopause and menopause. In her private practice in the San Francisco Bay Area, she helps women and men in midlife and beyond to lose weight, have more energy, increase their motivation, their drive, and just feel great in general. She graduated from Cornell University, went to medical school at UC Irvine, and got her master's degree at UCLA in community health education. Dr. Liz walks her own talk. So important. When she turned 50 a few years ago, she celebrated by climbing to the top of Mount Kilimanjaro in Africa. Hopefully I'm saying that right. Dr. Liz has two awesome young adult sons and enjoys hiking and Argentine tango with her amazing husband. Dr. Liz, welcome to the show.
Thank you so much. Happy to be with you.
I actually had a client that did that same climb, and she did it before she had double hip replacement. She wanted to do to do this before she went in for surgery, and I trained
Wow.
her, got her as ready as we could, and then trained her after she went through the surgery. So that is
Oh,
just amazing. I've heard that that's very challenging.
that is very inspiring. I got a chill listening to you. I'm so glad that you helped her do that. It is challenging, and also what I always like to say is if anyone hears that and they go, "Huh, I would be interested in finding out about that," then my message is go do it. It's my
Mm.
mother pictured picks and those things that you do to no, there's none of that. It is hiking, and if someone's inspired to do it, they should get someone like you to help them and just plan it and go do it. It's really fantastic.
How long did it take you to hike to the top?
I did a 7 day, so you can do it in a lot of ways.
Ooh.
There are people who do it in 1 day up and back. We saw them go running past us. It's like a running club. Okay, so these are people obviously who are used to at the altitude, and there's a lot of criteria. I could never do that, but and I figured I had crossed it off my list. But then I met my husband, and he says I would be interested in doing that, and I was like, oh, seriously? Okay, fine. So at some point, should we choose to do it again, which really would be great, I would love it. We would do an 8 day. The extra day is spent at altitude. So really, it's very doable. It can be done in a lot of different formations, but we had a small group of us, and it can be done. If someone's
That
inspired
sounds
to
like
do it,
so much fun.
it's
I'm
really
now
great.
considering this,
Good.
especially since I've had my back surgery and hopefully can get back to hiking very soon and do the things I enjoy. And then you
Yeah.
do tango with your husband. That's another thing I've always wanted to learn.
Yes, God bless them. My family's from Argentina. My parents are both, well, they also happen to be retired doctors, but they're both born and raised in Buenos Aires. And so I've always had the music kind of in me and always enjoyed it. But then I started learning about 12 or 13 years ago, really going to lessons regularly. And then I met my husband about 8 years ago, and God bless him, because it's harder to learn to be the leader in this stance, and he likes it, and he has stuck with it. So it's very enjoyable. It's very free form. I really like it from a partnership standpoint and a move the body. It's a lot of fun.
It's really beautiful to watch. I always had a fear that I would try to lead because I have a tendency to do that when I dance, and so I would have to suppress that.
That's right. It would be a new opportunity for you. You're 100% correct. When I first started taking lessons, there was an assistant teacher, this tall, handsome guy, and he told me that there were local therapists that sent women to these classes to learn how to just relinquish a little bit of control, let someone else lead just for the few minutes that the song lasts. It's a very nice kind of spirit level exercise. So, all right, now something else for your
Ooh,
list.
yes, I love that idea too, because I imagine it could be very therapeutic to just say, okay, I'm going to relinquish control, and
Yeah,
because that's definitely me at times. I don't like letting go of
yeah,
control.
yeah.
Now, I want to talk a little bit about your career. Now, were you always interested in perimenopause, menopause? Did you see that being a specialty, or was that born out of your own personal experience?
Well, combination. I will say that when I was in medical school, when we're in medical school, we rotate through different specialties. So when I was doing my OBGYN rotation for about 10 weeks, I happened to be following that day the chief resident, and she went into a room and I followed her in there. So I just sit in a corner and listen. And it was a woman who was having a lot of menopause symptoms. She was really uncomfortable, hot flashes, night sweats, couldn't sleep, all the usual list. And I just remember this doctor that I was following talking with this woman. And I don't remember if she prescribed any hormone replenishment. Probably she did, but we can say more about that because the timing was back in the 90s. Uh, but what really sticks out in my memory is how much better the patient felt from a listening ear, from the doctor listening. It was like a therapy, like just the encounter was very therapeutic. So that really stuck with me. That's
Mm.
And then OBGYN, of course, is a lot of fun. And then it got to a point where I really wanted to narrow my focus. I had my children who were little. I wrote my first book. So I was 43 when I went into menopause. So all of
Wow.
that was happening around the same time, and I'm 59 now. So I'm getting ready to turn 60. So that'll be me getting more advice from you about that.
You look amazing.
Oh, thank you. Thank you. Thank you. So that's really such narrowed. No, not delivering babies anymore, getting to sleep at night instead, letting go of the major surgeries and then the minor surgeries. And now I entirely focus on perimenopause, menopause, andropause. And it's a lot of fun. I love what I do.
You know, it's really the narrative has changed so much over the past, I want to say 10, but I think it's more like 5 years that the narrative has really changed. Because I just remember, as I described at the beginning of the podcast, what I went through going to my OBGYN, and I loved him. He was wonderful. So I have nothing bad to say here at all. But I don't think he really had the training to help me at the time. So I kind of got the whole, well, this is kind of normal, and hormone replacement therapy was never discussed. I didn't even really know it was an option. And then we had the Women's Health Initiative
Mm.
study that had come out, prior to that. So I was terrified, absolutely
Right.
terrified to go on hormone replacement therapy.
I'm so sorry that you were terrified. I remember when the Women's Health Initiative, which we'll call the WHI, came out in 2002, 2003, and I was in the middle of selling a house, my house, and my realtor came in and she looked terrible and she was beet red and dripping sweat, and she just like it's all she could do to get herself to my couch and just like drop herself in my couch. And I knew exactly what had happened. I knew she had been unceremoniously yanked off of her hormones. And that press release came out before we doctors even had a chance to read the study. So that's unfortunately how those things were sort of unfolding at the time. And I just knew that the truth was not going to turn out to be the disaster that everybody was predicting with the very, very scary headlines that initially came out of that. So luckily,
Mm,
we've come a really, 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 really long way from that. That was over 20 years ago. That's a whole
wow.
generation of doctors, unfortunately, influenced by that study.
That is so unfortunate. And many women that didn't get the help they needed. So maybe
That's right.
they suffered needlessly through not just the symptoms, but we're talking about brain health, osteoporosis,
Yep.
cardiovascular health, things such as that, where they
Yep.
really
Bone
weren't.
strength.
Yes,
Exactly.
everything. Estrogen is so protective. And of course, testosterone plays a role as well, and progesterone, all of the hormones. So yeah, I'm glad to see that narrative change. And I think too, I didn't understand at the time that studies can have flaws. There could be things that are misinterpreted. So there was this tendency at the time, if a study came out, we didn't question it. We took it at face value.
Right.
Now,
Yes.
are you seeing with women that they're going through perimenopause, menopause, and we know that there are cognitive things that can happen. So there's the brain fog, maybe suddenly more forgetfulness. I know I would just feel like I was walking around in this haze. And then I would think there was something wrong with me. Like I had no clue that other women were feeling that exact same thing. I had no clue that they were having anxiety or depression. I just thought there was something wrong with me. So then I felt very isolated. Is that something you've seen, women feeling just very isolated going through this transition?
Yes, absolutely. Again, in over 30 years of doing this, I have definitely seen that. To what you said earlier, social media has its faults, but creating community is one of its strengths, and it was one of the original goals. And so a lot of women nowadays can easily learn that they are not alone. The biggest problem that I see, which is related to what we're talking about, is the doctors who are not knowledgeable. And I have heard the phrase, and I think this is the correct phrase, which is medical gaslighting,
Mm.
still to this day, where the doctors are saying, oh, you still have your period, so it can't be your hormones. Or they're saying, to what you were told, it's natural, or I call it the J word. You just have to live with it, or you're just getting older, which I absolutely encourage women to completely reject the J word.
Yes, yes. I was definitely. I think the perspective was, this is natural. Like you said, just
Yeah,
live with it. And yes, it is natural. But I always say suffering is optional, especially when we have other means available to us today that can help us through that.
I love that. I love that phrase. That's exactly right. It's related to what I like to talk about, that uh, getting older is a blessing, but feeling old is optional.
Mm-hmm.
But I totally love what you say. Suffering is optional. I, that's really good. That's really good. I've said it I've said it a different way, which is that you don't have to tolerate the suffering. That women, sometimes we have a bad habit of tolerating things, tolerating people, tolerating discomforts. And when we learn to not tolerate it and advocate for ourselves, we can feel better. And I think that's beneficial to all concerned.
Oh, absolutely. And
Mhm.
now, when a woman comes to you, she's having these symptoms. Maybe she's had some weight gain. That's another big one where it doesn't have to be that way. The way I feel is if we make certain lifestyle adjustments, which are necessary, I believe they're absolutely necessary. We can't do at 45 what we did at 25 or at 65 what we did at even 40. It has to change. What is your approach with helping them navigate through weight loss and through some of these symptoms that they're having that are hormonal?
Absolutely. I love that. I totally agree with that. To add to that is that when we're younger, there's a little bit more of a leeway. We have more of a buffer between bad choices and poor outcomes. Whereas as we get older, we have to pay more attention. As the building gets older, it needs more maintenance. We do have to pay attention. And also, just to piggyback on what we said earlier, that this is a natural process. However, we have a modern problem, which is we live decades in menopause now. And that didn't used to be the case, right? 100 years ago, only 5% of women reached age 50. Okay, so we're playing a different ball game now.
Yeah.
So my approach is very holistic. I want to combine both worlds. I grew up in a medical household, so I've got that medical background, but I also am very of my own pursuing training in the preventive medicine world. So it's kind of a spectrum of doctors where very disease oriented, protocol driven on one end. And then the other end is kind of extreme, like the doctors who take care of the movie stars and well, everybody's heard about crazy stuff down at that end. But on this side of the middle is the holistic approach, which I use the word holistic to mean the whole person. So I'm looking at
Yes.
the female hormones. I'm looking at the usual types of tests, but I'm looking much more deeply. I'm looking at thyroid, adrenals, vitamin levels, looking at the all the systems. That's the first part of my approach.
And I'm sure integrative in a sense where, yes, the holistic, the whole person, but then I think of integrative in terms of, because my nurse practitioner does this, she pulls from Western medicine and then she pulls from other areas such as the nutrition, the supplements, the lifestyle, and combines the two.
Yep.
Because I see a lot of, okay, all of medical advice is bad, and you got to go this all natural approach for everything. And I think that the answer lies between.
Absolutely. Exactly. There's no need to be all one direction or the other. We want to take the benefits from all of these different worlds. I take the benefit from my Argentine background where getting older is considered an honor and older people are honored in the society and older women as well getting sexier as we get older. That's a thing in the culture that I was raised in. So I had good examples in that regard. So I think that, the mindset, right, to what you were saying earlier, the mindset, of course, the medical. I love bioidentical hormones. We can talk about that as much as you want us to. I could talk about it all day long. But I love replenishing hormones, not in the anti-aging world. I'm sort of putting it over here on this side of the spectrum. Some of those doctors go very extreme, and they're talking about replenishing. You should have the level of a 20-year-old. But as I like to say, there's a reason we don't want 20-year-olds running the world. Okay. So we don't want to be driven by hormones. We just want to go back to like the way Suzanne Summers used to describe it, which is why wouldn't you replenish your hormones to not that long ago when you were really feeling great? So I think that's important as well.
Yeah, it's reaching that optimum level, not necessarily trying to have, because we're not going to have 25-year-old ovaries and have that
Exactly.
production, and we don't want testosterone too high. That causes problems too. So that balance is so important. Something I do see a lot of, I see this with supplements, I see it with hormones as well, is I'll make a post about hormone replacement therapy, which I don't do very often, but I'll talk about what I'm doing, or I'll talk about a supplement. And boy, will my messenger just light up, and they want to know exactly what I'm taking. And I'm trying to say, no, 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 that's not the point. I can't tell you,
Right.
and my levels aren't going to be right for you. And the other issue I see is they think it's a fix all. Like if I just give the
That's right.
hormones, I'll lose the weight, or I'll have the
That's right.
energy back. And the thing that I did was I had already put all my lifestyle habits in order when I sought help when I believe I was 51 by the time I found my nurse practitioner. I was already strength training. I was already, doing the cardiovascular training. I was walking. I was working on my sleep, my stress, my water, my nutrition. I was dialing in my macros, all of those things. And I was still suffering. So then I got the hormone replacement therapy. It was like, oh, missing piece of the puzzle
Yeah.
right there.
Beautiful. That's beautiful. That's exactly right. It cannot be done without the lifestyle factors. Just feeling our best just can't be done. Or as I say, I cannot out hormone your lifestyle. There's
Ooh,
no magic bullet. I wish there were. That'd be great. I would use it too. Okay, but there just isn't one factor or one magic bullet that is going to fix everything and allow people to not do all the important things that we have to do, manage our stress, manage our mindset, get enough sleep. That's totally critical. So
Oh, it really is.
when I'm looking at hormone replenishment, in fact, sleep is one of the places I usually start, including for weight loss. Okay, we know this, right? The more we learn about what happens in our bodies while we sleep, it's just incredible. And as the knowledge grows, it's just more and more mind blowing, all the work that our body is doing while we're sleeping. And it's a deal breaker. It's a deal breaker for weight loss. It's a deal breaker for libido, right? We cannot compensate for exhaustion in intimate relationships with the people that we care about. So
Mental
all
health.
a package.
Yes. I notice if I get poor sleep, okay, I'm hungrier, and I'm not hungry for tilapia and broccoli.
That's right.
I'm hungry for quick energy. You know, the brain
Yes,
wants that
yes,
quick energy.
yes.
And then also I feel anxious. Like I'll
Mm,
have, because I've always had a problem with anxiety pretty much my whole life, but it will just soar. If I
mm,
have miss a couple of nights of sleep, or it's restless, or I don't get deep sleep, and I wear a Aura ring to help me
yep,
track it,
yep.
I can feel that with my mental health. I don't have resilience. I don't handle things very well.
Yes, and I don't think that's personal to you. Here we are. We each get issued one human body when we're born into this lifetime. And so this is not, and I'm saying this to you, but I really want everybody listening to take this to heart, is this is not like a personal failing. This is our design. It's our
Yes.
design. And we just have to give our bodies what it needs in terms of good fuel, good sleep, kindness, the same kindness we give to others, right? Sometimes we look in the mirror and talk to ourselves in a way that we would never talk to someone we actually like. We would never say those things. We would never judge that harshly. So I think all of that is really important. So that's
It
great that you have that dialed in for you. So that's really beautiful. That's great.
It didn't used to be that way. Going
Good.
through my 40s, you know, typical woman, three kids running three different directions, taking care of aging parents that were sick. My father was sick with cancer. He moved in with us. And so I was, you know, chasing around kids, running the household, doing all of the
Wow.
things.
Wow.
And I just thought sleep wasn't important. And I thought, oh, you know, I'm not sleeping well. I guess this is what happens when you get older. And I just accepted it, not knowing how absolutely important it is. And even from an insulin sensitivity standpoint, because they have found that we can be insulin resistant just from losing a night's sleep.
Exactly. It's incredible.
It
Yeah.
really is. I love that you start with that. I started coaching many years ago, and I used to just jump right into the nutrition. You know, okay, here are the foods, here are the macros. I would jump into the exercise, never talked about sleep at all. And now it's where I start. How are you sleeping? How are you managing stress? Because nothing's going to happen if we don't address this one thing. Now,
Absolutely. That's great.
with hormone replacement therapy, we hear a lot about estrogen and a little about progesterone. And I just want to touch on the benefits. Like we talked about brain health and estrogen being protective of muscle, protective of bone, progesterone, really sleep. People think of in terms of sleep, but I think testosterone is still misunderstood. We think of it as a male hormone or as a libido hormone.
That's exactly right. A lot of people don't even realize that women have testosterone. So we, of course, don't have anywhere near as much testosterone floating around as men do. They have at least 10 or 20 times as much as we have. However, it's very important for women. It helps with libido. In my clinical experience with my patients, it's not the deal breaker factor. It can help, when other things are in place. Libido is more complicated for us. It's not as linear as it is for the guys. So there's so many factors that matter to us in order to feel motivation in the area of sex and intimacy. But it's helpful with brain sharpness, muscle development, metabolism, mood. I really think that it's a mood stabilizer. I think it's the main reason that men look at us and they think, what? Everything's fine. Okay. So I think that that's helpful. I have had women tell me a lot about stress tolerance. Stress tolerance improves, right? Our normal lives have stressors, physiologic stressors. That's how we grow and learn. That's okay. But we also don't want it to crush us. We want to feel good. We want to feel confident. I call it the confidence hormone. We want to be feeling confident that we can do the things that we need to do.
Yeah, there is that confidence, and I think of motivation,
Yes.
to get up and go. Because I remember starting to lose that motivation for things in my late 40s, going into my 50s, and my levels were completely tanked by the time I got in. Now, do you have a preferred method of delivery? There's different ways women can do hormone replacement therapy. And of course, they don't have the same options that men do. Men have far more options in that area. But there's the injections, there's the pellets, there's the creams. What do you think of the delivery methods?
Okay, so I definitely want to say a quick word, and if we want to spend more time, we can, for estrogen, as long as it's through the skin. That's the bottom line about estrogen. So gels, creams, pellets, anything other than oral. That's really the most important for estrogen. Progesterone, we can talk about. That's beautiful, calms the brain, helps a lot with anxiety, helps with sleep. And then testosterone, as so interesting, this is something recent in my life, is that my mom, who's about to turn 86, she had breast cancer when she was 68, and she did great. She had a lumpectomy, radiation, and that's been it for all this time. And she was, of course, taken off her hormones. I say, of course, because up to now, that's still the going understanding, even though that's not really what the data shows. But she's lost a lot of bone mass. She's lost a lot of height with vertebral fractures. And so now she has so much pain that she had an orthopedist who's young. God bless him. He's in his 50s. And he's aware of the literature and recommended she go on testosterone. Now, she's my
Wow.
mom, so I don't give her medical advice, not very much at least. But she's asking me about it. So I thought that was really interesting and fantastic. So for testosterone, it has to be from a compounding pharmacy at this point in time, at least in the US. We do not have anything that's FDA approved and sold in regular pharmacies for replenishing testosterone. It can be under the tongue. It can be a topical gel or cream. I do love the pellets. As I mentioned, I went into menopause 16 years ago, and I've used the pellets for the last 9 years. And so I really like those. When I start a woman on testosterone, I like her to use something that's easy to stop, which would be the under the tongue troche or something topical, not because I'm worried about any health risks. I feel very strongly from ongoing, detailed looking at the literature that there are no health risks. I have taken apart studies that try to say it increases cancer or does this or that in terms of a bad health outcome. And I am very persuaded that testosterone does not have health risks for women. What it can have are side effects.
Right.
Okay, women know about this. A little bit of facial hair, maybe a little acne. That happened to me when I first started it. It tends to settle down. All right. And I just started with pellets. I was learning about the pellets and I was the guinea pig. So there's this 4 doctors in this training session that I flew to another state to go do. And then I was the guinea pig. I brought my labs with me. And then I sat there on the table while the doctor teaching the class showed me and to everybody and did the pellet procedure. And that's how I started using testosterone. But with my patients, I usually prefer to do something like the under the tongue troches or the topicals, at least at first. until she can get a sense, right? Like there's different women respond differently. Some people don't get any side effects at all. Some women have a little bit of facial hair acne and it settles down like it did for me. Or they get those side effects and they really love it, like they feel a big benefit from it. And then there's ways that we can control the side effects. So that's pretty much my thinking process as I introduce. I also don't put it in initially. So if a woman has not been on any hormones, I want to wake up the receptors first. A little bit of estrogen, maybe a little bit of progesterone, depending on her needs. Okay, maybe either of those. And then a little bit down the road, get her feeling better, get her sleeping before we introduce testosterone. That's my approach.
I love that. Very, very similar to my nurse practitioner. We started with all topicals. It was an estrogen progesterone cream on one arm, and then I would do a testosterone cream on the other. And it worked beautifully for a long time. And then I don't know if it's because I put on a ton of lotion or what was going on. I just suddenly felt like I wasn't getting the same benefit, especially from the testosterone. So then we moved to the patch for the estrogen, a progesterone capsule that's compounded, and a once a week small injection of the testosterone. And that has worked beautifully. Now it might change again for me, but that's worked beautifully for me.
That sounds really great. You're absolutely right. I don't use the injections for women that often, so I forgot to mention it. So I'm really glad you brought it up. That's absolutely fine if a woman is comfortable doing that. That's another wonderful way. Yeah. The pellets are great because instead of doing an injection every week, you would be dealing with it only about every 4 months or so. So 3 months, 4 months, depends. I have women who go 5, 6 months in between their pellet insertions. So I'm a fan, definitely a fan, even though I don't have patients start with the pellets. But you're absolutely right. As long as women feel good, that's my goal.
Yes. And I love that you don't start there because I do think sometimes that influx, especially if they haven't had anything and all of a sudden it's flooding the body, it's not like you can shut the gate and turn it off. But with the cream, you can pull it back. You can have a different compound. You have a lot more control. Even the injections, I know I've experimented a little bit more. Oh, nope. I'm feeling a little angsty, kind of road raging. And then I pull it back. And so you get that self-feedback. But I think it's just interesting to note that we are so individual and what works for me might not be the best option. And I've had clients who are even very, very sensitive to estrogen and have to do this little tiny dose.
Yeah, absolutely. Yeah, the patches can be in a nice low dose, but again, to our discussion, the topicals work great for that. Something compounded. There are some that are available at regular pharmacy, but to be able to go at least for sure at the beginning, we want to start low, go up slowly. That is my method that I like to do. It's what I like for myself, and that's what I like to do with my patients.
Yes, makes sense.
Yeah.
Now, with estrogen, there's been a lot of emphasis lately, and I love this, on the brain health aspect. I believe it's Lisa Moscati. Am I saying her name right? That wrote some books on the subject, very, very interesting. And I've seen a couple of her podcasts that she's been on, but talking about what happens to the brain post-menopause and how important estrogen can be in that.
Yes, absolutely. I remember some data. This was probably only about 10 or 15 years ago, and it was showing that yes, women have some cognitive issues when they go into menopause, but the study was saying, but then it settles down after a couple of years. And that's definitely not correct. Some women can have these cognitive problems for a really long time, and half of women will never completely stop having symptoms related to menopause, which is just way too high of a percentage. And we live too long to, as you're saying, to tolerate the suffering. There's just no need. So absolutely. I think there's a cardiovascular role for the cognitive benefit.
Oh,
And that, of course,
interesting.
is, yeah,
Explain, can you explain
yeah,
that connection?
sure, sure. The microvasculature, we know this in the vagina, the vaginal tissue, which is the same as the base of the bladder. All right. So women who are dealing with urine infections that the doctor says, well, I don't know why you're getting these bladder, it's because a little bit of estrogen is going to be really helpful. Okay. And the way it does that is it improves the micro blood supply to these tissues. Okay. So same thing, I think, with heart health and cardiovascular in the whole body, skin. All right. The glowing skin that we want to see. We want to see good blood flow to the skin and then to the brain. So I just think that unfortunately, the WHI study used oral estrogen and found cardiovascular problems. But we now know that those problems happened because oral estrogen goes into the stomach, over to the liver, and stimulates clotting factors to be produced. So when we use estrogen, and there are some women out there that is all they can tolerate. And we have to keep in mind absolute risk versus relative risk. The absolute risk is still really, really low. So I think I have two people in my entire practice for the last 15 years with oral estrogen because that is all that they can tolerate. And I believe that they're going to be just fine. But if at all possible, we want to put estrogen through the skin, we want to do something topical, and we are still going to get those benefits without the cardiovascular side effects the WHI showed.
Such a good point. Now, when you have a woman and she comes in and she has, say, a history of breast cancer or even any type of cancer for that matter, what, because I get this question a lot. I'll get a mess, and of course, I can't address it. That's outside my scope, and I'm not the expert. But they'll be asking, what can I do? I had breast cancer. It was 3 years ago. It was 2 years ago. It was 4 years ago. And I'm afraid. What is the protocol, I guess, would be the question, or how would you address that?
Okay, so very complex question, very important, very scary. Okay, I mentioned my mom had breast cancer when she was 68. That was almost 20 years ago, and she's doing really, really well. But I go to get my mammograms, and I feel a little moment of, uh-oh, hopefully this one goes well also, right? And so I have a couple of answers to the question. Number one is the data is really very clear that estrogen does not cause breast cancer to happen. Most women get breast cancer. The average age is 68, exactly when my mom had hers. And that is 10, 15 or more years after menopause of not having estrogen. Okay, so we have that. We have, and this is not to say that if a woman has breast cancer, a woman with an active, newly diagnosed breast cancer, yes, I think she should come off of her estrogen while everything's being done, all the treatment. Okay, so we're not talking about feeding an existing cancer. We're talking about bigger picture, longer term picture, I should say. So even the WHI, so the WHI made that big, huge fuss starting in 2002 when there were two arms of the study. The arm of the study that had the women taking oral estrogen and a non-bioidentical progestin. Little note in that point. That's very important. So that arm of the study showed a trend. It did not reach statistical significance, but because it was a trend, they stopped that arm of the study. That was the beginning of the explosion of the fear of hormones. Okay. There was another arm of the study, though. These are women who'd had hysterectomies, and there's a prevailing understanding that a woman who's had a hysterectomy does not need progesterone. We can talk about that if we have time, because we've already said progesterone helps anxiety and sleep. Okay, so some women who've had hysterectomies, they will benefit from a little. But the going understanding for sure at that time was you don't require it because you don't have a uterus that you have to balance it at the level of the lining. So this is an arm of the study where women were either given an estrogen, not the right one. They were given an oral estrogen, but nonetheless, they were
Okay.
given estrogen or placebo. The women on estrogen had a lower incidence of breast cancer.
Mm.
This data has come out almost 20 years ago, and nobody heard of it because the fear was already, it had already taken hold. Okay. So that was even with the wrong kinds of hormones, the wrong women being studied, because they were all 10, 15 years into menopause, so they weren't having symptoms, and the wrong route of administration of the hormones. So even with all those wrongs, it still found a lower incidence of breast cancer. So for a woman who is cleared by her doctors, I always want to collaborate with the whole team. All right. Does she have an oncologist? Who else is on her team? Where are they considering her treatment? Are the word cure doesn't get used a lot around cancer, but I'm hoping that going forward it will be used more in the future, because my mom's a perfect example. She really was a cure. So in any case, we'll have that information eventually, as we get more genomics and other types of testing and markers in the blood for cells of cancer before anything's detectable. So I think that'll come eventually. So for a woman who's got that in her personal history, it really depends on what's happening with her. Let's say she's having vaginal dryness and pain with sex. It is pretty accepted, even among oncologists, that it is okay for her to use a little tiny dose of vaginal estrogen in order to regain her quality of life. So there's that. If she's having hot flashes, other types of systemic symptoms, maybe she'll need to use some other methods. It really depends on everyone's comfort level. Okay. If she comes to me and she says, I've read everything and I'm fine and I want the hormones, I'm going to be fine with that because I know she's right. Another option is, to our discussion, is testosterone. Testosterone can help a lot with a lot of symptoms, the brain sharpness, even sleep, as well as muscle and metabolism. So testosterone is also pretty well accepted out there as something that is going to be okay to use after breast cancer.
That's interesting that you bring up the testosterone because automatically it's just this big black or white, like, okay, I can't do estrogen, so I can't do anything. And so I hadn't thought of the
That's right.
testosterone having some of those same benefits for muscle, for cognitive, for energy, for all, all of the things so a woman can feel better. So I'm really glad you brought that up because
Yeah.
there's so much confusion right now. And like I said, I'm not the expert, so I never want to advise someone. And I think I always tell women go in well informed, do your own research, find somebody who's trained and literate in hormones, and then you can have that discussion about whether it's appropriate for you.
Yeah. That's a very important point. Regular doctors, I mean, I did medical school in here in the US, and there's minimal training in nutrition. 1 week out of 4 years of medical school addressed nutrition. And again, it's just the minimum amount to address disease prevention. So there's that. Supplements, natural supplements can be really helpful, help your adrenals, help your thyroid in terms of feeling better. But if a woman is really suffering, it's about quality of life. Okay.
Yes.
And it's an individual decision. Okay. But what I don't like is when doctors do the scare tactic. That's definitely not my approach. I'm definitely going to let's do close surveillance and let's see what benefits you experience. Start very low dose, increase things very slowly. So there are really women don't need to suffer. A lot of
Ah,
options.
absolutely. I know by the time I went in and found my nurse practitioner, and I told you how afraid I was of the hormones because of that study, I had reached a point where the symptoms overrode the fear. Like it was
Yeah.
so miserable. I was only sleeping 2 hours of sleep a night, mainly because of the night sweats, hot flashes, opening the window in Albuquerque in the middle of winter when it's 20 degrees outside because I was hot, and then
Right. Everyone
waking
else
up
has to wear a
freezing.
parka, but you got to have the window open. Yep. Yep.
And feeling embarrassed sitting in a meeting and suddenly having, the flush and the sweat and all of those things, vaginal dryness, a low libido. So then it starts to affect your marriage. So by the time I went to her, I almost didn't even care if there were side effects anymore. I was like, can
Right.
I have my life back? I just want to feel like Carol.
Yeah. Yeah. That's exactly right. That's the subtitle of the first book that I wrote is simple. Dr. Liz's Easy Guide to Menopause, 5 Simple Steps to Feeling Like Yourself Again. Because that's exactly how women were describing it to me, is I just want to feel like myself again. And women still say that to me.
They do. Yeah,
It's just,
they say it to me
that's,
too.
yeah, exactly.
They'll
So,
say that. Another one I hear is I feel invisible. And I hear that quite a bit too.
yes, that there's so much to that. There's the youth worshiping culture. And so that's where the spotlight shines, and so those folks are going to feel that they are visible, and so that's really interesting. I think that's a very interesting. It's certainly not a good feeling. That's not good at all. But it is. I don't know. I really I like to think about what it means to get older. Uh, do I need the spotlight as much as I did before? Nope, I don't. It's very different. But feeling invisible, no, that we don't want. We want to feel agency. That I really want for women, right? When we're 3 years old, like a little 3-year-old girl, she does not have that issue. She's in charge.
She's going to be seen and heard.
Yeah, yeah, exactly. And then we learn not to be quite so visible. So absolutely, but feeling invisible. No, we don't want that. We want to feel good, feel confident, be visible when we choose to.
I like how you put that. And I really love the idea of, do I need the spotlight? No, not like I used to. Because I think of, okay, why do I have my nails done and my hair and all of the things I do for my skin? And I thought about that. It's not to be in the spotlight. It's for me. It's
That's right.
because those things make me feel good.
That's right. Let me help you with that. My Argentine family background, we go to Argentina a lot, and women don't even second guess that stuff down there. It's not a thing. There's hair salons on every corner. They're usually like a group effort. You can go in and someone can do your hands and someone can do your feet and someone can be washing your hair all at the same time.
Oh,
And
heaven.
you're in and out of there. I'm just saying it's really fun. Okay. It's not expensive because people go often. All right. So just wanted to share that with you, and I don't, I don't feel that it's as judgmental there. Maybe that's because I don't live there. I'm not sure. But we don't want to judge each other. We want to care for each other and care for ourselves as well as caring for each other. And 100%, for me, having a pedicure, it just gets me into my body. Same as being a nice, fun exercise class. There's a lot of benefits. It's not just for other people. It is a wonderful. It can be for women who like it. It's a great boost. So
It is. And you're
okay,
right about the judgment because I've gotten those comments on my social media where they'll say something like, well, natural is better. You need to be totally natural. And then I go look at the profile and there's a picture of a cat or a pug or something.
right.
There's no person there.
Yeah, yeah. It's like, well, this is a big downside in social media. The being judgy. Why do we need that? We don't need that.
Mm-mm.
If a man
And
goes and cleans up and wants to do this or that, he doesn't get put down by his
oh
peers as
no.
much as we women have a habit of doing that to each other. So that's too bad. And I'm with you. Fun things to things that save me time are good. You know, if I'm not spending lots of time with taking care of the package, then that's fine. But there are things that then when I go out, then I don't have my attention. Then I'm not self-conscious.
Right.
When
You're feeling
I've had
comfortable.
things, yeah, when I've had whatever it is I want to do, get whatever nails done, etc., then I go out and then I'm not self-conscious. So that's it. Like you said, the benefits, that's okay. If the benefits are for me, that's all right.
Yeah, and women doing what feels right to them. Some women want, really short hair and no makeup, and I say, okay, great, because
Right.
that's what you want, and no judgment there either. We should be doing what we feel comfortable doing, what we want to do, what lights us up, what makes us feel good.
Absolutely.
And I'm going to Argentina. I'm like, after your
You
description,
must.
I've got to
It's
go.
yeah, gotta go. It's really great. It's a very warm culture. People are very friendly. The besides the fact the food is great and it's beautiful, totally belongs on your list.
Now, there's one question I want to circle back around to the hormones because I was thinking of it and I failed to ask it. And this is another one that I hear a lot of. So, let's say somebody's 60, they opted not to have the hormone replacement therapy. They've, they've been in menopause, let's say 10 years, 8 years. Is it too late for them?
I love this question. The answer is no, it's not too late. It's not too late. What's really fantastic is that the Menopause Society, which formerly was the North American Menopause Society, they do a detailed review of the medical literature about every 5 years. And in their most recent one from 2022, they actually said that the data supports that there isn't an actual time where it's too late. The idea came, again, sadly, from the WHI that there's a window of opportunity that's about 5 years, and once you're more than 5 years, you're out of luck. That came from that study, and it particularly came from using the wrong women and the wrong hormones. So these women were 10, 15 or more years into menopause. They didn't have any more symptoms. And what we assume is that they had other issues settle in by that time, other illnesses, loss of bone. Um, Actually, the WHI showed that hormones help bone density, even if you start it later. So that was ironic. But so the wrong women, and then also the wrong hormones. So the oral estrogen, as we mentioned, increased the risk of cardiovascular adverse events like stroke or heart attack or that blood clots, that type of thing. So it's really never too late. I would say, I take care of women of all ages because I'm seeing hormonal issues in younger and younger women, but really mostly women in their 40s and 50s. But I've had women, they come in. I had one woman, she was 60 and she did absolutely fine. She felt great, went into menopause, really didn't have any problems. And then she turned 60 and just everything just went downhill fast. And her biggest number one issue that we fixed really quickly was that she just couldn't sleep. So she'd been fine for years and years and then started having all of the problems.
Oh, wow.
So luckily, we were able to really, really get her feeling better, get everything working again, get the metabolism working again, all of those important factors. So really, in my view, it is barring other contraindications, which are very rare, it's most pretty much never too late.
Oh, I love that so much. Yeah, 60 is a game changer. I have to attest to that. Getting ready
I'm
to turn
excited.
63, and it's wonderful. But I know I had to make a few adjustments. I was like, oh, what's that? And what's that? And just these little changes, just like when you turn 40 or you turn 50, and
Yeah.
a little bit of a wake up call. So I could definitely see that happening where somebody kind of went, okay, I'm good. I soared through my 50s and now here's 60, and it requires a different approach for sure.
Yeah, I love that. That's awesome.
Now, is there another question that comes up a lot because I get this one, a point where we should go off of hormones, or is this something we can do for the rest of our life?
I love that question. I think that's everyone's first question. Of the women that I take care of, that is either their very first question or early on. So I have a few answers. Number one is using hormone replenishment does not commit you to using it forever. I think that's really important for women to understand because they're suffering, but they're afraid to use anything because then they think that they're stuck forever. And that's not true. So that's number one. You can perfectly legitimate to use things for a little while, a year, a couple years, 5 years, however long. Second answer is my personal answer, me personally, what I plan to do. I plan to use hormones forever. Will I use the same doses? Maybe not. Maybe over time, depending on what I experience. And now that I'm being coached by you when I turn 60 next year and kind of see if there's adjustments for me to make. So it's always important to monitor and make adjustments. So there's that. But even if I were to develop breast cancer, then I would stop hormones during the treatment part. And then I would resume minimum testosterone and probably also a small amount of estrogen to help my bones. Right? The outcomes from early detected breast cancer are way better than outcomes from hip fractures. Everything. Mortality is worse with a hip fracture. Everything, all kinds of bad outcomes are much more likely after a hip fracture than they are even after breast cancer. So that is me personally. Okay. Then what I tell women, so I tell women those answers. And then I also say that it's always about weighing everything, risk versus benefit, and your quality of life. That's really the most important factor. But I honestly think that a little bit of estrogen to help the bones is really, really essential. I think over time we'll get back to more data to support cardiovascular health, brain health. I do think that we'll see that. So there's definitely no age to that is required to stop. And I am a supporter of using hormone replenishment on a lifelong basis. That's my
Love
bias.
it. Love it. Because I fully intend to do this the rest of my life. And like you said, I may be reassessing how much I need or the delivery method over time, but barring any something unexpected, I fully intend. And I know when I first went on, I thought, oh, I'll be on this till I'm 60 and go off. I don't know what I was thinking, but that's what I thought. It's like, no, I need it
Right?
now more than ever.
Yeah, absolutely. Feeling good is good.
It is. Well, Dr. Liz, I want to be respectful of your time. I have really enjoyed our conversation. I sincerely mean that. You're just a delight. You're so positive. You put off, not to sound cliche, but some great energy. I love it, and such a role model for women that want to age powerfully, age well. So thank you so much.
You're so welcome. I love we both have our butterflies too. We're committed to this transformation, this life growing and transforming. So I love that.
Yes, the butterflies. I had forgotten I had mine on. So, as we start to wrap up, first of all, was there anything I didn't ask you that you'd like listeners to know? And second of all, how can listeners connect with you, work with you, and follow you?
My website is the central place to go. It's drlizmd.com, drlizmd.com. Everything is on there. We can connect on social. You can write to me, ask me questions, read blogs. Everything is centrally located there. So I love to connect with everybody. A newsletter that I send out from time to time. Also, people can do there. There's a quiz people can take. There's some goodies on there. we have touched on what I think are really the most important points. You started us out with saying that suffering is optional. I just really, really want to emphasize that. That's what I mean when I talk about rejecting the J word, the circle and the line through, don't accept the word just getting older, just have to live with it. That's absolutely not true. Our birthright is to feel good and to feel as good and as vibrant as we want.
Love it. And such good advice for women. Um, I just enjoyed our conversation so much. Thank you again, Dr. Liz.
So welcome.
And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.